learners. Today we are going to discuss the block 2, unit 4 and 5, which is theoretical approaches to counseling. So let us see the different theories which explain how to treat, what to treat, and the theoretical background of the treatment approaches. So first we are going to discuss about the psychodynamic approach. So in psychodynamic approach, we'll discuss about the psychoanalysis, psychoanalytically oriented psychotherapy, and insight therapy. So what you will learn after listening this lecture, you will learn about the psychoanalytic approach to counseling or therapy, goals and techniques of psychoanalytic therapy, role of a therapist, and insight therapy and its goals. So what is psychoanalytic approach? So basically, this psychodynamic therapy is basically roots in classical psychoanalysis of Freud. Psychodynamic approach is an umbrella term, share commonalities between unconscious and the psychic determinants. Behavior is the result of interplay of internal drives, role of childhood experiences. Insight during therapy helps in process of change and discuss about the defense mechanisms. So psychodynamic means psyche means soul, as we know earlier the definition of psychology was the science of soul. So psyche means soul, and dynamics means idea of force or motion, means when the different it basically work in different direction. So interplay of so many factors. So basically, it is based on the conflicting forces, inner drives, wishes, memories, ideas. So basically, it is a model of human and personality development, theory of personality and human nature, and a form of psychotherapy. It means psychoanalysis is basically giving a model of human and personality development, and it also gives theory about the personality and human nature, and it is also a form of psychotherapy. Psychoanalysis helps in individual to release emotions, repressed thoughts, feelings, memories. Repressed thoughts means most of the wishes, most of the needs are not socially appropriate or not ethical as per superego. So all the such thoughts will be repressed or are repressed in the unconsciousness. We'll discuss in detail in further slides. So, what are the theoretical principles of psychoanalysis? So, role of unconscious and psychic determinism, structure of personality, and defense mechanisms. So, we'll see in what is psychic determinism and so let us see the role of conscious and psychic determinism. So unconscious, basically most of people are unaware. So it means we are not aware about our wishes or desires which are there in our unconscious. It composed of emotions and desires which are repressed and contains most basic impulses that are not expressed in society directly anymore. Why? Because it is not acceptable in the society. Human actions are a result of unconscious desires. So, according to Freud, whatever we are doing, most of the things are guided by unconscious desires. Or unconscious determines one's behavior. It means our behavior is determined by unconscious, and this is the psychic determinism. It's like viewing something as a result of predetermined and not free choice. Okay, so slip of tongue and certain other behaviors are guided by, already decided by our unconscious. Let us see this ego, superego, and id given by the Freud. So id is completely unconscious. So basically, uh, it is guided by pleasure principle, and whatever need is there, it want to fulfill immediately. So there is always immediate need for gratification, whereas superego decide what to do, what should not be do. So superego basically having lots of shoulds. You shouldn't, you should, okay, you shouldn't tell a lie, you shouldn't harass anyone, like this. And the main job of ego is to manage the conflict between superego and id. Why? Because when the desires from id come to try to come to consciousness, when it reaches to subconscious level, it threatens the ego. So ego tries to manage between two. Let us see in detail in further slides. So Freud has given structure of personality, and so a tripartite theory of personality given by Freud is it consists of id, ego, and superego. So what is it? Id is completely unconscious, and it's basically guided by thanatos and eros. Thanatos means death instinct, and eros means life instinct. So basically, it contains aggression, violence in thanatos, and seeking pleasure and sex in eros. So it is basically guided by pleasure principle. So always all needs they try to seek pleasure and fulfilling all the desires and act on basic instincts. So whenever there is a need, it wants to fulfill it immediately. Now let us see the super ego. So ego basically is situated mostly in conscious and subconscious. So some parts of ego is also in subconscious, operates in real world. So it is basically guided by reality principles, and the middleman between its desire and superego's demand. So it is basically working like a middleman between whatever desires it send and whatever restrictions superego put. Then it provides compromise between two, that is id and superego, and tempts the id and avoid pain while keeping social demands. So this is the main job of ego is to manage the unwanted or such desires which cannot be fulfilled directly in the society due to so many restrictions. And the superego contains all suits. It is ideal self, you should be like this, that internal representation of external values imposed by the demands of society and based on the moral principles. So basically, superego developed by the society and the religion. So let us see the what type of defense mechanisms used by the ego. So any threat to ego raises anxiety. So to manage the anxiety, ego basically uses defense mechanisms. Okay, so there are certain defense mechanisms like repression, regression, displacement, denial. So and suppression. Suppression is, in true sense, it is not a defense mechanism because suppression done consciously by the person, ego. So all these defense mechanisms are used unconsciously by the ego. Okay? It is not like the person is not aware about the defense mechanism which he is using. And if someone points out also, person denies. No, it's not like that. So what is repression? Repression means whatever thoughts, unwanted thoughts, which cannot be, or immoral thoughts or sexual thoughts come into mind or try to come into subconsciousness. Eh, Superego says no, you can't fulfill your desire. So ego has to repress them. So this is called repression. But repression doesn't mean the desire vanishes. No, it remains there for longer period of time, and whenever it gets chances, it come out from there. Regression means going back to the earlier stages of development, like the 40 years old person or 20 years old person behaving like a 5 years or 10 years old child. Displacement means you want to hit someone, but you are hitting someone else. You are displacing your emotion to one person, another person. Denial means you are not accepting that there is any problem or there are any such desires. Why? Because you are not aware. So you basically deny. So it happens in a certain crisis also. We do not accept, we deny, and we are not aware that we are denying it. Intellectualization is basically uh, giving the uh, in, intellectual input and try to justify the certain thing, and whereas rationalization means you give some reasons for your failure, for your certain act. Okay. Then reaction formation, then sublimation, projection. Projection is also very commonly seen in psychotic patients, even in normal. So whatever needs are needs are having in you, you are projecting on others. Suppose you are a dishonest person, you are not very honest. So what you in your talk you always say that others are not very honest. They are lazy. They do not want to work hard in such time. Sublimation is basically uh, this when you use your energy or the needs or desire into socially acceptable manner. Okay, one of the example of sublimation is like sublimating the sexual need to writing a religious book. The example of Tulsidas is there. Coming to goals of psychoanalysis. So let us see what are the goals why we do psychoanalysis. So the first goal is to make unconscious conscious. Means the job of the therapist is to know what is unconscious and help the client patient to understand it. Resolution of unconscious conflict. So there might be lots of conflict between id and superego or certain other needs. So resolve these unconscious conflict. Otherwise, you may feel anxiety, you may have certain other symptoms. Strengthening of ego. So if the ego is fragile, it will not mediate between id and superego. You can imagine that a weak person cannot stop two strong persons fighting. So ego should be strong. So ego strength should be more. Reducing the intensity of instinctual striving. So there are lots of instincts, lots of desires, needs are try to come into consciousness to fulfill it. So the goal of psychoanalysis is to reduce the intensity. Why? Because if they keep on coming into subconscious, the person always feel threatened or anxious. Facilitating insight development. So insight about the behavior, insight about the uh, this defense mechanisms. So what are the defense you are using? So you will get insight and you will work in a better manner. So remember this thing. If the person is using more defense, it means the person's mental health is compromised. The person's mental health is not good. So less defense mechanisms should be used, not more. So then insight, self-realization or self-knowledge. So all these are the goals of psychoanalysis. Now see the what a classical psychoanalyst do. So it's like they practice neutrality. So it's like blank screen approach with little self-disclosure and effective expression, and abstinence, avoiding expression of affection advise or display too much of their own issues. So basically, psychoanalysts, they do not self-disclose. They only allow the client to ventilate, to express their needs and desires. So when there are no obstructions, so the control of the superego will be less. So desires in id will come in the consciousness. So the psychoanalyst will know, and then he or she will help the client. So what type of client can go for psychoanalysis? So like readiness to commit to the exhaustive long-term therapy and adherence. Why it is called exhaustive long-term therapy? Because psychoanalysis cannot be done in 5 or 10 sessions. It's long-term therapy. At least 2 3 years it takes to complete, and the person should be adherent to the treatment. Let us see the techniques used in psychotherapy. So there are various techniques. Interpretation is the first one, free association, resistance, dream interpretation, transference, and counter-transference. So let now we see in detail what are these techniques. So you will get an idea about, like, it's very difficult to practice psychoanalysis because it needs long training, which is not there in our country, and actually it is not in practice. But still, some of the countries, some of the practitioners, they are practicing uh, psychoanalysis. And so if you want to practice, you have to go for at least 3 to 5 years of training just for psychoanalysis, and then you have to do your own self analysis. After that you can become psychoanalyst. So let us see what is interpretation. So it is basically explanations provided by the therapist about behavior of client. So if certain behavior which client doesn't understand, so therapist provide the information, provide the explanation of such behavior, why the client is behaving like that. Repressed material in unconscious. So whatever material come into conscious, therapist try to explain all those repressed material, why such materials are there. Then the therapist also explain the dreams. So client generally, they are encouraged to share their dreams. So therapist job is to interpret those dreams. Free association. So this is the basic quality. So why? Because if you are not allowing the client to freely talk, then it will be very difficult to get any meaning from the talk. So when the client is talking, you are giving some association with the certain act or behavior of the client to those needs and desire. Then interpretation of the resistances. So because it is long-term therapy, so most of the time resistance are seen in the therapy. And transference. So basically transference is positive or negative emotions when they are projected on the therapist by the client. So now let us see a little bit in detail. So what is free association? So clients are encouraged to remain relaxed, speak whatever comes in their mind, providing reassurance that everything that is coming to the mind of the client is relevant. Why? Because most of the time client think such some things, something is not very important, something is important. So they do not speak about the non-important thing which they think is not very necessary. So here the therapist job is to encourage the client that everything is relevant. So whatever come into your mind must express it. So during this, it is the id that speaks and ego is silent, and superego also, they are silent. So here id gets full opportunity to express, to send the needs and desires which were suppressed, repressed for long back. So some repressions are lifted to some extent due to this free association and to see the connections between the event. So sometimes the certain events are not understandable by the clients. So therapists try to make connections. And what is resistance? So it is basically inhibitory forces. Anything that work against the therapy is called resistance. It is due to interaction between therapist and client, due to therapist under training, non training or less training, or due to client's personality or certain other issues. So it comes from the aid to sidetracking the discussion. So this is indication of resistance. Refusing to recall dreams or childhood memories. So clients say, I can't remember, I don't remember. I don't think anything such thing happened in my childhood. Nothing happened in my childhood. Okay, changing the subject of discussion. So clients generally they try to change the subject of discussion. So this gives an indication of that the resistance is there. Missing appointments with a therapist, coming late for therapy or postponing sessions, forgetting to do what was agreed upon in the therapy. So all these are indications of resistance. And in dream interpretation, so basically Freud said dream is a royal road to the unconscious. Means it's very difficult to go to know about the unconscious of the client. So you should know about the client's dream. So dream will take you to unconsciousness. And so disguised form of unconscious material, okay, symbolic expressions. So because in dream certain things were there which you try to connect but you can't find any meaning. So Freud has given such meaning to. So if you know about the client, you will understand that why what this object means for the subject. So direct expressions are painful. So that's why dream interpretation is very important. They are disguised and presented indirectly. Ego defenses are weakened during sleep. That's why it becomes easy to have certain dreams. But still, some filtering is there by the superego. So the objects they basically converted into certain other objects. Suppose the client want to eat rasgulla, so he may not see rasgulla in dream. He may see something else. So this is the job of the psychoanalyst to make the connection between two. And in dream interpretation, basically repression is lifted during the dream, and the conscious and unconscious takes the form of dreams. Conscious elements relate to the real life, and unconscious elements are unfamiliar and bizarre. So sometimes you might have experienced that is some you had a dream, but you are not able to make it any meaning. Why? Because some of the material in the dream was unfamiliar and bizarre. So why those things were unfamiliar and bizarre? Because they represent unconscious. So basically, there are two content in the dream: latent content and manifest content. Latent content, the whatever manifest content is there, the therapist job is to find out the what is behind those content. And what is transference? Transference, you might be very aware about this word. Transference is very commonly used in psychotherapy. So basically, transference occurs due to relationship between the client and the therapist. Okay, if there is no relationship, no transference. Okay, so it is basically redirecting emotional response onto the therapist previously, like to a past relationship. For example, the client may see the therapist as a father figure or mother figure or something like that. And it happens due to unconscious. It is cathartic, means that whatever desires were there, get the opportunity to come into the consciousness. So, and can be positive and negative. So positive means when all positive emotions are projected on the therapist. Negative means when all negative emotions are projected on the therapist. So this is transference. And what is counter transference? So basically the simple difference in transference and counter transference is client and therapist. So if emotions of clients are projected on a therapist, it is called transference. But when therapist emotions are projected on client, it's counter transference. Counter transference will be always negative. It will not help in therapy. So this is the therapist's job to deal the transference and to understand if there is any counter transference. So therapist emotional response to the client can be used to understand clients better and level of insight. This might cause damage to the client. In most of the cases, it causes damage. So for example, overprotecting. Sometimes the therapist starts behaving like father or friend. So they are not supposed to behave like that. So let us critically evaluate the psychoanalysis as therapy. So the concept of psychoanalysis are used in other therapies. We all know there are many psychodynamic therapies which are using concepts of psychoanalysis. It provides a support for diagnostic tests, for example, interpretation of thematic apperception test, Rorschach psychodiagnostic, and this is the first theory affirming childhood sexuality. It talked about the different psychosexual stages of development. Anonymous and detached stance of the therapist. The therapist is not going to disclose his or her own issues with the client, and most of the time, the therapist remains detached. And mostly used in urban areas because in rural areas it's not possible, even in Western countries. Not suitable for psychotic or disoriented clients, not useful for older patients or with memory problems. And it basically, as I told you, it demands rigorous training. Without training you cannot become rigorous training, you cannot become a psychoanalyst. It ignores impact of social and cultural aspect on the individual, on the client, and most of the assumptions and hypotheses cannot be verified till that some of the assumptions given by Freud not tested. So let us see who are the persons attached with psychoanalysis, like the two disciples of Freud, Adler and Carl Jung. So Carl Jung given about the collective unconsciousness. Erikson has talked about identity crisis. Anna Freud talked about ego psychology. Karen Horney talked about the theory of neurosis, and Kernberg talked about the transference-focused psychotherapy. Let us see the psychoanalytically oriented psychotherapy. So it is a milder form or low intensity of psychoanalysis. Flexibility in approach, sessions 1 to 2 times in a week. Patient gives a sitting instead of lying on a couch. It's brief and time limited, and the more emphasis on ego functioning and current problems. So this is also psychoanalytic oriented psychotherapy is also helpful in or very successful in treating emotional problems. Limited problem focus on client's life and personality. So focus is less on mm, client's life and personality, and the main goal is ego strengthening. So if, as I told you, if ego is strong, so ego can manage well with superego and it. But if ego is fragile, it will always feel anxious, threatened, and may not be able to manage it and superego. So it reduced emphasis on free association. Psychoanalytic oriented therapy is not emphasizing much on free association, whereas Freud given much emphasis on free association. So let us see the insight therapy. This is third therapy we are going to discuss in this unit. So what is insight therapy? Insight means you might have read in mental status examination. Insight is one point. Insight means basically becoming aware about one's feeling, emotions, and behavior. Whatever you are having, you are aware. So it is basically on a continuum. You may be aware about 40%, 50% of some problem, and you may not be aware about at all about some other problem. The same way, some people are very much aware about their problem, so they are on the higher extreme, whereas some people are not aware at all, so they are on lower extreme. So it is basically understanding about the self, not other self. How beliefs, thoughts, feelings, experiences, and life events affect one's life. So this also it gives understanding about the feelings, thought, emotions, how they experience and how they affect their life. And types of insight therapy is psychoanalytic insight therapy, psychodynamic insight therapy, gestalt insight therapy, existential insight therapy, and humanistic insight therapy. So it means you have to use certain therapies to develop insight into the patient. So if your goal is to develop insight into the patient, so whatever type of therapy you are using, it becomes insight therapy. Let us see the psychodynamic insight therapy. So it basically facilitating insight of the patient, becoming aware of the unconscious psychological processes. Insight cannot be given or planted in client's mind. Client develops insight by the help of interaction. So this is very important. You cannot give insight to patient because you cannot plant insight into client's mind. Sometimes patient may feel offended if the insight is not given at proper time. If it is given prematurely, the patient may feel offended. So this is your job to collect the material and to assess the patient that when the patient becomes aware about himself, then you try to give some insight. So and not only it is not only for the client, it is for us also. We should also develop some sort of insight for our behavior, our emotions, our thinking, our belief system. So we should have insight. We must have. For a living healthy life, healthy mental life, insight is a very important task. So basically, it is making connections between past experiences, past feelings, motivations, and conflicts with present behavior. So if there is any conflict, so psychodynamically insight-oriented therapy helps in making connections. So whatever problems and perceptions are there at present, and whatever past feeling or emotions were there, so it is basically trying to make connections between them. So basically connection between past and present in terms of cognitive and emotional domains. So basically psychodynamic oriented therapy, insight therapy is cognitive, and it discuss about the cognitive and emotional domains and the revelations of maladaptive defenses. So it also works on the defense mechanisms. So what are the issues can be dealt with inside therapy? Childhood traumas. Childhood traumas means you are dealing with the adult who had a history of childhood traumas, any history of abuse, the struggle with interpersonal relationships. So all these past experiences basically affect the person's present behavior. So this is the job of the therapist to make connection to why the person is behaving like this, because there was a history of abuse. The child was abused. That's why he has developed such type of feeling, emotions, or thinking. So the connection, once the client understand, oh, so then he will not behave in such manner. And it is also very helpful when there are conflict in interpersonal relationship. For example, marital discord, husband-wife relationship, interpersonal disturbed relationship between friends. So it also gives insight about the behavior, why the person is behaving like this, because something happened in the past. So the understanding the past will definitely give insight into the present behavior. So the techniques, as I told you, almost all therapies use these techniques in classical psychoanalysis used by Freud. So free association, dream interpretation, resistance and transference, and exploration of affect. So, uh, so let us see how useful is insight therapy, or how various schools or thoughts of a school have criticized or understood it in as a therapeutic tool. So the effectiveness depends upon the client therapist relationship. So if the client therapist relationship is maintained, if it is strong, definitely there will be some changes in the behavior of the client. It will show effectiveness. It will also, like, the effect is also depend upon the building rapport, trust and openness is essential. So if like building rapport is easy, but trust and openness is little difficult, it comes with practice. So the therapist has to practice a lot. Evidence exists for insight levels and treatment outcomes. There are various studies which says that insight therapy is very effective and it gives positive outcome. And this therapy is very effective for anxiety, depression, eating disorders, relational issues, family or academic problems. So basically, it is very simple. Like if the person knows why I am doing this, my behavior is like that, why I get easily irritated, why I get annoyed, why I get provoked. So if the person understand these things in connection with the past, it will be very easy for the person to change the behavior, to develop the insight into the behavior, and the person may feel happy. And there are criticism also, like such therapies absorb the client into the therapist framework. Why? Because the connection between present and past is done by the therapist. So whatever therapist framework, it is imposed on the client. And it is also said the insight developed by the client may be pseudo, means may not be true. It may not be true insight. There may not be such connection between this present behavior and the past behavior. Okay. And self misunderstanding may be there due to this therapy. So we had discussed about the unit 4, in which we had discussed about the psychoanalysis in detail, and then psychodynamic therapy plus insight therapy. Now we'll discuss unit 5. In this unit, we'll see about the existential and humanistic approach of the psychotherapy. So in this unit, we'll discuss about the existential therapy and person-centered therapy or client-centered therapy. So existential humanistic approach is called third force in the psychology. So it is basically amalgamation of existential and humanistic schools of thought. There were so many scholars, therapists, they were using either existential or humanistic approach. This approach is basically giving low priority of the symptoms. So in therapy, most of the therapists generally they focus on the symptoms, but existential and humanistic approach, it doesn't focus on the symptoms. And higher priority to personal experience and growth is given. So it means existential and humanistic approach is very good when the person is having less symptoms and wants personal growth and understand the personal experiences. So the overall goal to increase the self-awareness rather than giving insight, it's aware, it's also related to insight only, but you will become self-aware. And self-acceptance, whatever you are, you accept yourself. Okay, so once you start accepting yourself, you start loving yourself. And once you start loving yourself, you love others also. You care for others also. Okay, so this way it changes. But if you don't accept yourself, if you don't accept, like some of us are having this thing very common, my height is little bit, it should be more, at least 2 inch, it should be more. My complexion should be more fair, little fair. Okay, and my shoulder should be a little broad, this, that. Okay, so nose should be like this, head should be like. So all these things says that you are not accepting yourself. So try to accept yourself. But accepting yourself doesn't mean if you are getting only 50-60% of marks in exam and you say, okay, I'm accepting. No, try to work hard because it is not God gifted. It's not given thing. So you have to, whatever you are, whatever the way you behave with others, you try to accept that. Yes, if you are poor, not rich, no need, you accept it. Yes, you are poor, no need to hide, no need to show off that no, you are okay, no need to expense more on grooming. So this is an example of self-acceptance. So if self-acceptance is there, you will feel highly satisfied. And we all work for our self-satisfaction. But we want self-satisfaction, but we do things which actually don't satisfy us. So freedom of making choices, personal free will, and self-actualization. So self-actualization, you might have read in certain theory, there are hierarchy. So now let us see the existential therapy. So there are three pioneers of existential therapy. They are Viktor Frankl, Rollo May, and Irving Yalom. So Yalom is, I think, mostly now people are practicing, but Frankel and Rollo May is also followed by many psychologists. They are practicing. So they were interested in issues of freedom, meaning of life, anxiety, search for values, responsibility, isolation, and death. So this therapy is not a very well defined or a structured approach. Basically, it is following a philosophical approach. So what happened? Like Freud was giving his interpretation to client. So they think, no, that is not required. There is no need to interpret. Let the client interpret. Let the client self-disclose. Let the client acceptance, develop self-acceptance. Let the client decide about the therapy. Let the client decide about the session. So everything should be, and they basically focus about the personal growth rather than symptom removal. Though they also talk about the symptom, they also work on the symptom removal, but that is not the primary goal. So it inclined towards asking deeper questions on human suffering, meaninglessness, and other related themes. The client as sick, rather someone who is sick of life or clumsy at living. It strikes a balance between limit of human existence and limitless possibilities and potentials of human life. So basically, they try to teach the client about the limit of human existence. Our life is limited, maximum 100 years, 110 years, but average life expectancy is around 70 years. But the limitless possibilities and potentials of human life. So it is juxtaposes the brighter side of life, courage, hope, meaning, with the darker side, anxiety, dread, death, etc. So basically, your focus should be on the brighter side rather than darker side. So some basic dimensions of existential approach, self-awareness, as you told. So basically, existential therapy help the client in self-awareness, choice and responsibility. It is client choice and responsibility to improve certain behavior, to develop certain behavior, to quit certain behavior. So it's a responsibility of the client. Need to maintain uniqueness and individuality. So this existential approach basically talk about the uniqueness of the individuals, and they think all individuals are unique, and they respect the individuality. They do not try to put the human being into one or two or three groups. No. An ongoing search for meaning, purpose, values, and goals. So in this therapy, therapists help the client to search for meaning of life, purpose of life, values of life, and goals of life. So it is basically philosophical type of uh, therapy. It also deals with existential anxiety. What happens if I die? It also acknowledgement of the impermanence of life. So it says that life is limited. Okay, it is not permanent. So acknowledge it. So no need to get fear of that. So let us see the goal of existential therapy: to increase self-awareness, embrace the authentic self. So there are many self: real self, social self, ideal self. Okay, so whatever you are there, so it should be authentic, and you accept that this is yourself and you love yourself. To reach up to one's fullest potential. So they also believe that the client is having many potentials. They are not uh, approaching, they are not using those. Why? Because they are engaged in, or they are disturbed with so many other things. So the therapy helps them to reach to the fullest potential, so they can use it. Building and maintaining a healthy relationship, becoming responsible and taking the charge of one's own life. Okay, so you are the boss of your life, creating one's own destiny. So they also take you, if you do the certain thing, so you can create your own future. So what are the techniques used in existential therapy? Logotherapy given by Viktor Frankl. Finding meaning in life. He who has a why to live can bear with almost anyhow. Okay, so these are the statements taken from their books. Meaning making is a motivational force. So keep the meaning, because if the life becomes meaningless, what people will do? They do, they attempt suicide. Okay, so it's very important to always make meaning of the thing. Okay, focus on subjective experiences. Client client counselor relationship is central to the process of therapy. So here the focus is more on the therapeutic relationship, I and the concept, and mutual journey of self discovery. So here therapist is not going to say that I am going to help you. Therapist generally say that ki, these discussions will help us, you and me, in self discovery. It is like a journey of self discovery. As we know, there are certain critics of each and every therapy, so this therapy is also having certain criticism. So basically, it lacks systematic principles and techniques, because it is based on more or less on philosophical principles, most widely influential, yet least officially embraced approach. Some concepts are hard to define, like authenticity, being in the world. Basically, it is like whatever you think you are, so it is real, and being in the world, live in a reality, more or less. The amount of maturity, experience, and training required from the practitioners. So it doesn't mean that it is based on the philosophical principles, so anyone can do. No, it requires lots of training, and too much emphasis on client, individual. So it is basically individual centric. It's not like group. Why? Because they do not put the person in group. They do not label the group. Okay, if the person is having the person is schizophrenic, or the person is psychotic, that way they do not try to put the individual into group. Now let us see the another type of therapy, which is called person-centered or client-centered therapy. So we all know that it is developed by Carl Rogers in 1940s, and it is basically extension of his thought on human beings, their potential, and the best way to facilitate their growth. It is basically effective approach, subjective view of human nature, and self-awareness acts as a fuel to personal growth. So it also focuses on the self-awareness, and phenomenological approach, like certain experiences are crucial for one's learning and enhancement and self-worth. So it gives more emphasis on the experiences for learning and self-growth. So this is Carl Rogers, American psychologist, and it says that when I accept myself just as I am, then only I can change. So the first thing for personal growth is accept that whatever you are, you accept it. Then only you can work for your growth. So each human being is rational and worthy, according to Rogers. They know inherently what is best for them. Is also true. Most people were inherently good, positive, constructive, forward moving, and trustworthy. So they think that human beings are very good. Whereas some others think कि human are also equal to animal or like animal, but they are social animal. Whereas according to existential approach, client-centered approach, they think कि they are good, they are constructive, they are trustworthy. So people becomes the best version of themselves, work towards reducing their inbuilt flaws, that is like defenses and cognitive distortions, and defenses mean defense mechanisms, and cognitive distortions like we'll see in detail in our future lectures on cognitive behavior therapy. That is also one type of psychotherapy where we will discuss about the cognitive distortions. Need for self-actualization, key driving force. According to Rogers, the key driving force is need for self-actualization. So, and the organismic valuing process, inner voice to guide them. Why? Because we all are having positive, constructive, forward moving, trustworthy. So, our inner voice should guide us, not the others. Other may not guide us. So, we have to focus on our inner voice. We should focus on our self awareness. We should focus on our self actualization. So, self actualization comes when we fulfilled our basic needs, emotional needs, then only we reach up to self actualization. The main focus is on the self, finding meaning and purpose of life, to resolve incongruence between the ideal self and real self, and reducing maladjustment. So let us see the incongruence in ideal self and real self. Real self means the whatever I am, and the ideal self means what I want to show myself in front of other. So causes of psychological distress according to Rogers is affected by self-concept. Self-concept is guided by society and its expectations from the individuals. Incongruence between real self and ideal self. The bigger the gap, the higher the distress, the more the problem. If there is a less gap or no gap, then the person is perfect. Society-based actualization, basically, the ideal self is basically society-based actualization, conditions of birth, conscious learned self, and inability to subdue the anxiety. So all these things are causes for distress. So Rogers working on these causes. So there are certain factors which can decrease incongruence if you focus on your organismic self-actualizing tendency, organismic valuing process, field of total experience, unconditional positive regard, positive self-regard, and focus on the self, real self. Whereas your incongruence will increase if you learn learn self, conscious self more, society-based actualization, valuing based on conditions of worth, symbolization of experiences, conditional positive regard, and conditional positive self-regard, and introjected self. So we should try to reduce, otherwise incongruence, otherwise breakdown will be there. So these are the goals of person-centered therapy, as we have already discussed. So role of the counselor is basically to help the person in self-actualization. And these are the techniques basically used in, techniques are more or less same, but empathic understanding, unconditional positive regard, genuineness of the counselor are the basic core techniques required for the conducting therapy. There are also critics like how the therapist learn. It's very difficult, non-directive approach. So how people will learn, hard to apply on shy or non-verbal clients, and discount past experiences. So past experiences are also having role. Thank you.